Hi, Linda here from N-Powerment Nursing. I'm here today to talk about the application of our question in the know. Today we're going to apply a question to congestive heart failure. This week we did a Facebook Live on congestive heart failure, so you may want to tune into that before you do this question. Here's the question. The nurse caring for a patient in the emergency room noted the echocardiogram report indicated cardiac hypertrophy. The nurse assesses the patient for 2+ pitting edema in the ankles as she assists the patient into bed. Based on this finding, what should the nurse do next? So before we even kind of get into the choices, we want to look at the stem of the question and try to understand what is it that we already know. Well, we know an echocardiogram, right, and a diagnostic exam that produces images of the heart. And so we have cardiac hypertrophy. What does that mean? It means that the heart has enlarged. So something's going on in the heart, making it work harder than it needs to, and it's gotten enlarged. It's like when you do a bicep curl and your bicep gets enlarged. The heart is very similar in that it's a muscle. So when extra exertion occurs in the heart, it enlarges. And what do we know about 2+ pitting edema? Well, it's a sign that the heart isn't functioning as well as it should because it's backing up fluid into the rest of the body. So we know that the heart is not functioning well. Okay, so let's go on and see what our choices are. A, weigh the patient. B, draw blood for labs. C, assess respiratory status. And D, insert a Foley catheter. Well, the answer really should just pop out at you here. The answer is C, assess respiratory status. Because we have edema, because we have a diagnostic exam saying that there's enlargement of the heart, we want to then look to see not only is there edema and other things going on in the body, but we would listen to the chest status, because perhaps if the heart is enlarged, it's not working properly, it could be backing up into the lungs. So we're going to also worry about fluid backing up there, and this is why we would assess respiratory status. For the answer to this question and more, please check out our complete study package.